that's why we've been saying for some weeks now that New South Wales is on high alert. We're taking health advice, but also making sure there isn't anything else further we can do to reduce the risk. We know where those high-risk areas are, we know what they are, but I want to thank everybody to date for not only following the health advice, but also for going that extra mile where appropriate to keep everybody safe.
Where were those nine?
Look, I do want to assure the community that already we have health officials waiting for those flights. Many of those people are New South Wales residents returning home. There are various checks in place, and if we need to do more, of course we will. We are every day considering all of our options in terms of what we need to do to keep the community safe, and can I assure everybody of that? As I said yesterday, and I've been saying for weeks, the health advice is always evolving. We respond according to what is going on in our state, what we foresee might happen if we don't take certain action, and we're always on our toes about what we need to do to keep things as tight as possible. Having said that, I do want to say that no border is impenetrable, and we've seen that numerous examples across the nation. No border is impenetrable, no matter how tough we are. There's always, so long as the virus is in and around us in Australia, there is a risk to New South Wales, and our geographic proximity to Victoria makes us the first line of having that seeding, and that's why we need to be extra careful, extra cautious, which we are. But having said that, we need to assume that every time we go out into the community that people in and around us have the virus. That's the way we need to act, and that's what we need to remember.
Anecdotally, it seems that people are giving advice. There seems to be a big shift in an uptake on public transport this morning, for example. Still probably 50% of people choosing not to wear masks when they're on trains and buses. What do you say to those people?
Well, look, I think we only announced our updated advice on masks yesterday. Shopping last night and had my mask on, and so did a lot of other people, and I think in the next coming days and weeks we will see that trend continue. We will see people take up the opportunity, and we also appreciate that we're providing very specific advice, and I trust the vast majority of people in our state to do the right thing. They know when they're going into a high-risk venue, they know when they might be exposed to social distancing, and they also appreciate whether there have been active cases in their community, which would make them more likely to have to wear a mask. We can't be complacent, because even with 1 or 2 cases of community transmission, we saw what happened at the Crossroads Hotel. An infectious person suddenly turned into us having to contact 600 people at that hotel, and then all of their contacts and the contacts of their contacts. So it only takes one case to get out of hand to cause enormous ripples through the community. So we can't be complacent whatsoever. We're doing okay, we're holding the line. But again, the next few weeks are absolutely precarious. We're about halfway through what we always knew would be a very difficult period. As soon as we were aware of the situation in Victoria or the extent of it, we assumed that it would take 4 to 6 weeks before New South Wales would know what our journey would look like during the next phase of the pandemic. And I just say to everybody in New South Wales, let's do the hard yards now so that we can have a better chance moving forward and not have to go into the situation which Victorians find themselves in. And on behalf of everybody in our state, I know that I speak for everybody when I say how much we empathise and feel for all of our Victorian friends and fellow Australians. They're going through a difficult time, and our thoughts and prayers are with all of them.
We had one case returning from
Well, what we need to do is make sure the health advice is commensurate with what we're experiencing on a number of services. The use of the public transport service isn't up to capacity, so on a lot of services, some services are near empty. So you need to judge yourself, and you should do what I do. I always have a mask in my pocket. If I feel uncomfortable about a situation, I can wear it if I feel that my social distancing is being compromised. So I would recommend everybody have a mask in their pocket or in their bag, and if they feel that they're in a situation they need to wear one, they should. But a lot of our public service is underutilised, public transport services. Some are overutilised, obviously, and we should take the health advice which is commensurate with the situation we're faced with in New South Wales. No, we always evaluate the advice we give the community based on whatever's happening in our state, and we look at a number of factors such as what is the virus doing, how widespread is it, what is the best way in which we can continue to bring the community together with us. And we shouldn't compare ourselves yet to what's happening in other states. New South Wales is in a unique set of circumstances. Our proximity to Victoria makes us unique, our population size makes us unique. The number of cases makes us unique, and so the advice we give our community is appropriate for New South Wales, and that's why I ask everybody to follow it.
And you gave me a call yesterday that people need social distance and maintain 1.5 metres from anyone else, no matter where they are. Does that mean that the COVID capacity limit on buses and trains need to be reduced because those green dots are not 1.5?
No, but what Health did was assess the safest way to catch public transport. So public transport is at between 48 to 50% capacity, and Health did a strict assessment of where people were positioned and where they were seated. And please know the advice we've given on public transport in relation to those green dots is based on Health advice. Health did a very detailed assessment, and remember, it's also not just potentially the distancing but how you're facing, whether everybody's facing forward, and all those things were taken into consideration. So the green dots on public transport were done after a detailed analysis by Health. But obviously, if you find yourself in a situation where people aren't respecting that advice, or people are jumping on a service when all those green dots are already taken up, well, then you should be wearing a mask. No.
Are you able to get an accurate measure of the number of people on carriages? I ask that because some cities still basically send parents messages home to remind their kids to tap on and tap off because a lot of them aren't.
Yeah. Well, obviously, we ask everybody to take the advice, and especially with school children, we've recommended to parents, where possible, try and have your child walk to school if it's in walking distance, try and drop them off at school if you have that capacity to do so, and as a last resort, encourage them to use public transport. When they are using public transport, of course, we expect them to adhere to the law, to the rules. This is a pandemic, it's not normal circumstances. Normally we'd be giving the opposite advice in terms of children getting to school, but in a pandemic we recommend, where possible, that parents walk their children or supervise their children walking to school, ride to school, or else get dropped off, and as a last resort, catch public transport. I'm sorry? Well, it's interesting, when you go down to the border communities, people are angry with me because I'm being too tough, and they would like to see the restrictions eased, but we are having to be tough on the borders because of the situation that faces us. No doubt the stage 4 shutdown in Melbourne and other parts of Victoria will assist us in that process. When Victorians themselves can't be mobile, that obviously helps our job in reducing the number of people that are likely to try and get across the border. But as I said, no matter how tough you are, borders aren't impenetrable, and we have to remember that. Unfortunately, people always, there are a number of people who might try and do the wrong thing, and that's been an issue across the nation, not just here in New South Wales, and we have to be aware of that. If you ask the border communities, they'll tell you I'm being too tough in not being relaxed enough for those border communities. I don't think we're being too tough. I think our response is adequate, but if we need to do more, we will. But we'll know in the next few days what that flow is like as a consequence of the shutdown in Melbourne, which obviously will have a positive impact to the way in which we can manage the virus here in New South Wales. I'm sorry. Well, we have to remember there are still New South Wales residents coming back. So it's very difficult to say to a New South Wales resident, you can't come back home. But obviously, we're not letting people come through unless they've got a very, very good reason. And if we need to tighten those reasons further, we will. But an example would be someone attending the funeral of a family member or something of the like. So please know that we have toughened things a lot in relation to people coming back, but you can't stop people who live in New South Wales coming back. And of course, we have strict rules around how we treat them when they do get back. Well, we've already provided the Education Department has already provided advice to teachers as to whether they want to do that. That's completely up to them. It's up to everybody's level of comfort as to what they do. But remember, the biggest risk for teachers, unfortunately, is other adults, and that's been the situation from day one.
Premier, iCare is facing financial crisis. More than 50,000 injured workers have been underpaid. What steps are you taking to address the issues with the scheme? Because many people want the forward.
Well, please know that when we came to government, the position of the Workers' Compensation Scheme in New South Wales was in the order of $4 billion in debt. So it is a difficult area of public policy to manage. And I know the Treasurer and everyone in government who has responsibility in that regard is looking at the situation closely, but there's nothing that's come to my attention that's over and above what is normal for that type of industry.
Okay, we'll leave that there for the moment. New South Wales Premier Gladys Berejiklian speaking there